Welcome again to Dr. Vanessa's Dermatology channel. In today's video, we'll be talking about the BOTOX procedure. If you are considering BOTOX treatment, the most important factors in this decision should be your safety, the experience and education of the physician who injects BOTOX, and the authenticity of the product used. At Dr. Vanessa's office, she is the only qualified professional in charge of BOTOX application. As a member of the American, European, and Colombian Academy of Dermatology, the doctor has been extensively trained in the injection of BOTOX for cosmetic purposes on the face. Many people are confused thinking that most injectable treatments are BOTOX. That's not true. BOTOX is the commercial name for type A botulinum toxin manufactured by Allergan, a multinational pharmaceutical. This is the most used, tested, and safest toxin that exists in the world. Since 2002, it has been approved by the FDA, Food and Drug Administration, for cosmetic use in treating facial wrinkles. Is it safe to get BOTOX injections? BOTOX is extremely safe when injected by a properly trained physician. BOTOX is one of the most researched and monitored products in the world, as it has been injected into millions of patients for over 20 years. Always ask your dermatologist to show you the Allergan BOTOX vial that will be injected. Treatment with botulinum toxin is considered safe, effective, and free of serious side effects. Almost all adverse effects related to BOTOX are temporary and benign. The benign side effects are well-localized, reversible, and self-limiting complications that develop within a few days of injection and usually disappear without any treatment, including bruising, hematomas or ecchymosis, temporary swelling or redness at the injection site, headache or discomfort in the treated area. How does BOTOX work? It is essentially used to temporarily improve or eliminate movement wrinkles in your face. BOTOX works by blocking the signal from nerves connected to muscles, with the aim of relaxing or decreasing the movement of the injected muscle. This reduces its ability to generate expression lines, making wrinkles that give that appearance of aging, tiredness, or stress on the face disappear. Forehead wrinkles, frown lines, and crow's feet are the areas most commonly treated with BOTOX. People who get the best results are those whose wrinkles appear when their facial muscles contract to make facial expressions. Wrinkles that are present all the time take longer to improve and may not disappear completely. There are multiple conditions that can be treated with BOTOX. Some uses that Dr. Giraldo offers are frown lines, area between eyebrows, horizontal forehead wrinkles, bunny lines, wrinkles on the upper part of the nose, eye contour wrinkles, crow's feet, wrinkles around the mouth, perioral, neck bands, chin, eyebrow lifting. BOTOX can be injected above the outer eyebrow area to create a lifting effect. Bruxism, reduction of masseter muscle size in the jaw and helps define the face. Reduction of sweating in armpits and hands or treatment of hyperhidrosis. Reduction or correction of gummy smile. Hemifacial spasms or facial tics. Facial paralysis. Treatment results are noticeable in less than a week and can last around 4 to 5 months. Almost all patients are amazed by the improvement in their face and how effective BOTOX application is. Who can get BOTOX injections? The best candidates for BOTOX injections are people over 18 years old, physically healthy, who are not pregnant or breastfeeding, and who do not have a history of neuromuscular diseases such as myasthenia gravis or multiple sclerosis, nor active skin infections. Adults of any age with healthy skin with moderate elasticity, but who are beginning to show signs of aging. Has realistic and subtle improvement goals and expectations. Wrinkles and expression lines are in areas that BOTOX can effectively treat, such as around the eyes, on the forehead, or between the eyes. Mild to moderate depth wrinkles. What should I do before the procedure? To reduce and minimize bruising after the procedure, avoid taking non-steroidal anti-inflammatory drugs, NSAIDs, such as aspirin, ibuprofen, etc., supplements, and anything that prolongs bleeding like omega-3 for 2 days before the BOTOX injection. Come with little or no makeup. To ensure you feel comfortable and avoid dizziness, we recommend eating normally before your appointment to keep your blood sugar levels stable and avoid any discomfort. If you're worried about feeling pain during the procedure, anesthetic cream can be applied, but you should arrive 20 minutes before the appointment to allow time for application and for it to take effect. How is the procedure done? Photos of the face in motion must be taken before the procedure to evaluate results. The amount of product used will vary depending on individual goals, facial anatomy, and response to treatment. Dr. Vanessa Giraldo will explain this during consultation because it is necessary to sign an informed consent before the procedure. BOTOX injections are performed with a very fine needle to inject small amounts of botulinum toxin directly into the facial or body muscles. Injections are usually administered at multiple sites based on individual muscle anatomy and treatment goals. The procedure takes on average 20 to 30 minutes. The cost of BOTOX application varies according to the number of units injected. In some people, it is necessary to apply an additional amount of botulinum toxin for the result to be correct. For the upper third of the face where wrinkles on the forehead, eyes, and frown lines are improved or eliminated, the application has an approximate variable cost of 1 million Colombian pesos to 1,200,000 Colombian pesos. This is the recommended procedure. The cosmetic BOTOX assessment has no cost if you have the procedure done the same day. You will be applied the correct amount at each point to improve or eliminate those wrinkles you don't want on your face. Remember that the dermatologist is the specialist physician in skin treatments. Your health and beauty cannot be in better hands. What should I do after the procedure? Sunscreen is applied to the face. After the procedure, for at least 4 hours, you cannot exercise or go to the gym. You must not massage the treated areas or face. You cannot lie down for 4 hours. Avoid going to saunas, pools, hair salons, dentistry, or spa on the same day to prevent touching of the treated areas. After 4 hours, you can wash your face normally and gently, and continue with all your applied care routine. It is preferable not to undergo other facial treatments during the first week. The next day, you can perform all your normal activities without any problem. You can use normal makeup, or if necessary, cover any bruising. If bruising forms, you can take arnica tablets, apply Absorb K, or apply ice the next day to reduce bruising and swelling. BOTOX injections take about 3 to 5 days to start working, but the complete effect of BOTOX treatment takes up to 2 weeks. Dr. Vanessa Giraldo recommends that all her patients wait 15 days after their injections to ensure their treatments have been effective and they have the best results. Results last 4 to 5 months. It is recommended to repeat the next application when the muscles in the treated areas of the face begin to contract again, which can be every 5 to 6 months. If treatments are repeated, the muscles will have less strength to mark wrinkles, and the effects of therapy may last longer. The botulinum toxin injected by dermatologist Vanessa Giraldo is BOTOX from Allergan, so you as a patient can be assured that you will receive only the best product available in the market from a properly trained dermatologist. It's important for you to know that the combination of anti-aging treatments is the best option to obtain excellent results in the quality of your skin and rejuvenation. Remember to schedule your appointment in advance with Dr. Vanessa Giraldo to perform your procedure. We look forward to seeing you and follow us on our social networks.